Hello again, everyone. Welcome to another edition of Meet the People. My name is David Feiner. I am the Communication Technology Manager in the City of Pittsburgh's Department of Innovation and Performance. And today we're going to do something a little different because we're not going to talk to an employee who's been here for a long time and is going to be here for a long time. We're going to talk to an employee who's actually leaving the city very soon. But he's already had such a huge effect, a positive effect on the city as a whole in his short time here, that before he walks out the door and forgets about us little people for the rest of his life, we've decided to bring in Josh Schneider from the Office of Community Health and Safety to tell us all about what he's done, what he's doing now, and what he's going to be doing in the future. Josh, thanks for joining us.
Thank you for having me. I will never forget you, people on City Channel, or anyone I met at the City of Pittsburgh for the rest of my life or career. So I just want to start off with that.
Said no one ever.
That's not true for me, I promise you.
Normally what I do is talk to employees around the city about how they've grown in their jobs, and but you had quite a bit of work history before you even got here. Why don't you give us a little bit of background, where you're from, and how you got to the city of Pittsburgh before you even started working for the city?
Sure. So I'm from Ridgewood, New Jersey, which is in North Jersey, about 45 minutes outside Manhattan. And I came to Pittsburgh originally to attend the University of Pittsburgh. I picked the University of Pittsburgh because of the great promise it had for pre-med students and the ability to go on into a career in healthcare. And I was interested in healthcare because when I was in high school, I became an EMT, where I volunteered for my local ambulance corps, and I was really interested in becoming a physician. So I came to the University of Pittsburgh because of the school's strengths in that. When I came here, I started out as pre-med, but I then went into the emergency medicine program at Pitt, where my junior year basically was just a paramedic school. So I became a paramedic in undergrad while majoring in emergency medicine. And in the course of working as a paramedic, I confirmed my love for practicing as a clinician and treating patients. But I saw so many systemic issues that I knew I wanted to address. I didn't feel like I would be satisfied making a difference on a person-by-person basis. I wanted to more practice medicine at scale on a larger level through policy. And so it kind of took me down this road. After leaving Pitt, I did AmeriCorps Vista in the mayor's office of the city of Pittsburgh. And I basically did overdose prevention work, which kind of led into the role I'm in now when the Office of Community Health and Safety was created, where I became the overdose prevention coordinator in that office. So that's kind of the road that I've taken to lead me here. I also am a public health advisor with the National Disaster Medical System, which is part of the Department of Health and Human Services at the federal government. So that's like an intermittent position, kind of works like the National Guard, where you're deployed if you need to be respond to a disaster, hurricane, flooding, national special security incident like the Super Bowl or things like that. So that's a relatively new position, but an area I'm interested in as well.
If I'm doing my math correctly, and please do correct me if I'm wrong, you were the number 2 hire at the Office of Community Health and Safety.
Technically number 3.
Oh, number 3 hire.
But I was really fortunate to be here as the office was being created, because I reported directly to Laura Dragowski as an AmeriCorps Vista when Laura worked in the mayor's office. So, as Laura was crafting the proposal, I was there to talk with her about it and just see it all come to fruition. So it was very interesting to see it go from, just Laura and I talking on Zoom during the pandemic about this prospective office that would come to be sometime in the future, to now working with about 15 other people, everyone from social workers to project managers, and seeing the work of the office that we always talked about take shape.
So what was it like as an AmeriCorps Vista and then becoming a full-time city employee? Did you, as the city's first ever overdose prevention coordinator, did you write your own job description?
I didn't write my own job description. I definitely had conversations about what that kind of position would look like. Certainly didn't actually write the words that went to the Department of Human Resources. But when I was completing my services in AmeriCorps Vista, it was very clear the need for someone to directly coordinate this work at the city of Pittsburgh. Obviously, for many, many years, for many, many decades, the city of Pittsburgh has not had a direct role in public health, although that role has fell to the county. And while the county does a good job at things like overdose prevention and human services work, there are always people that will inevitably fall through those gaps. And the people that fall through those gaps ultimately fall onto public safety. And public safety does fantastic work, but they're not always trained to handle some of the situations they have to contend with. And so it was important that someone is directly involved in coordinating policy and programs around overdose prevention specifically, especially because it is such a pertinent issue at this time. I mean, the overdose crisis reached a peak in 2017, dropped off in 2018 a little bit when Narcan was widely distributed, but is now approaching the levels that it was at in 2017, which we've just seen with the release of some data yesterday, showing another increase yet again in overdoses. So it was important that someone was coordinating this work at the city level, and also someone with experience in public safety, like my background in EMS, because so many of the programs that I've implemented, the work that I've done has been directly linked with public safety, specifically EMS, because that's our city's capacity to conduct direct patient care.
So since the Office of Community Health and Safety, as we now know it, is the first of its kind for the city of Pittsburgh, what has been all of public safety's, I guess, I know I'm generalizing this by saying it this way, but what has been the Department of Public Safety's reaction to another group of people saying, we'll take this off your hands and we'll focus on these things that you've been asked to focus on for a really long time?
Mm-hmm. I think there's probably a lot of recognition among people in public safety, whether that's police, fire, and EMS, that there are a subset of calls and individuals and situations that they have to deal with that they were never meant to deal with, particularly police. And so with that recognition comes another recognition that we need additional staff and professionals to take on some of that work. So we don't like to frame the Office of Community Health and Safety as replacing any other component of public safety. Rather, it's adding to what already exists.
That's fair.
So I think when we frame it like that, it actually has a pretty positive reaction among people in public safety. Obviously, I can't speak for them or speak generally, but that's generally what I've encountered. And we also have liaisons from each of the three main bureaus in public safety. We have a liaison from fire, police, and EMS who are in our meetings, who directly inform our work and help formulate a lot of the programs that we're implementing, so that we're actually consulting with people who are in these bureaus and not making programs and thrusting them upon others.
I've been reading, so I'm a voracious reader, and I read a lot of books. I'm in this kick right now of 1940-ish to 1980-ish American politics. Mm-hmm. And what I've learned through these books that I've been reading is that various bureaus of the American government refuse to coordinate with each other. CIA, FBI, they would keep secrets from each other. They wouldn't share information. So I imagine with police, fire, EMS, and community health and safety all together working together, that's a lot different than our grandparents. They wouldn't recognize government because everybody's being friendly to each other.
Well, David, that's a shocking revelation about the federal government, that they didn't cooperate with each other. I know our federal government to be nothing other than completely cooperative with each other.
Yeah.
Well, not really joking, but it's interesting because, when you say our parents, our grandparents can look at our government and not recognize it now, EMS didn't even exist until the 1970s. And it started right here in the city of Pittsburgh with Freedom House Ambulance. So definitely there's a lot that people from other generations would look and not recognize. But yeah, I mean, a lot of the work of OCHS is grounded in collaboration with all different parts of the city, and not just public safety, also with the law department to inform things, with the Department of Innovation and Performance, with city planning, with so many different bureaus and offices. Because when you're talking about health and safety, which is the primary focus of our office, given the name of the office, it doesn't just require public safety. There's so much that's involved in community health and safety, so many different parts to that, and so many different places where all the great the professionals in the city of Pittsburgh can lend a hand.
And I'm imagining also that your making decisions or putting forth policy based on real-time information or close to real-time information, based on the types of things that you're working on? Mm-hmm. Or are you just, hey, let's throw this at the wall and see if it sticks?
Well, certainly everything that we do is grounded in evidence and things that are informed by public health. But there are a lot of different areas that inform the work that we do. I think chiefly concerns that we hear from the community, and we have a community engagement portion of our office. We have two great individuals, Eric and Malaysia, that are leading our public engagement, community outreach efforts. And a lot of what we do is grounded in the concerns we hear from them and the priorities that they want us to focus on. We're also informed by lived experience of people that are going through these situations, which is similar to, but not directly the same as community engagement. And then there's also evidence informed by public health, by science, peer-reviewed research that informs the work that we do, and also speaking to the professionals that have been doing this work for a while. So hearing directly from police, paramedics, from firefighters to inform all this. So it all comes, I think, from many different places, but those are the main places where the work is informed from.
I know this is going to be a shock of a question, but do you like your job?
I love my job. And of course, the area that I'm focusing on is a difficult one. And the problem is not getting better, it's actually getting worse. But I love my job because all my life I've wanted to be in a position where I could identify a problem and actually be in a position to do something about it. That's what I've been looking forward to since I started becoming interested in healthcare. And I'm finally in that place. And it's also the intersection of so many areas that are of great interest to me and areas with great potential to help people. So it's the intersection of public safety, which I have a background in. It's the intersection of public policy and public health. Three things that I think always need to be joined together in order to provide for the health and safety of members of our community. And so because I get to sit at the intersection of those three things, I get to interact with so many people that I love to work with. I get to interact with and engage with so many different issues that are of such high importance, and really produce positive outcomes for the people that we're here to serve, the people of Pittsburgh. So I do love my job. I will be incredibly sad to leave my job because while I do very much intend to go back to a place in the future where I can be in a role to be at the intersection of all those types of issues again and make change on a broad level, I'm going to miss that for the 3 years that I'll be away from this type of work.
All of that said, and I know we're going to get to what you're doing next in a little bit, but in your time here with the city, what do you think are your top 500 accomplishments? And you're on the spot. No, really, just what are one or two or three things that you're most proud of while you've been working here for the city of Pittsburgh?
Sure. So there are so many great things that we've done that I'm really proud of. But overall, I just say that our general approach to overdose prevention has been one based in harm reduction. So that's reducing the negative consequences associated with any range of activities rather than just ignoring or condemning the negative effects. So you can think about driving a car as an example. We were just talking about driving cars before this. Driving a car is an inherently dangerous activity, right? Mm-hmm. But instead of outlawing having a driver's license or outlawing cars altogether, we have steps that we take to make driving a car safer. We have seatbelts, traffic laws, we have airbags, and all things like that, manufacturer regulations. So instead of saying, let's outlaw cars, we're going to make it safer, we do the same thing with substance use. Instead of saying we're going to put people in jail for using substances or punishing them in some way, we can actually take steps to make it safer. So we can make sure that all City of Pittsburgh staff that interact with the public are trained in overdose prevention and have Narcan available to them in the course of their jobs. We can decriminalize fentanyl test strips that allow people to make more informed decisions when they're using drugs. We can open a syringe service program, which we're doing. These are all things that we're doing. Open a syringe service program, which will happen by the end of this summer, which will distribute safe substance use supplies to people who use drugs so that they can be safer, reduce rates of HIV and hepatitis C, and also be a powerful engagement tool to speak with people and get them connected to resources, because these individuals are often so isolated from the systems that are designed to serve them. So, those are some of the things we've done. Also, one thing I want to mention as well is our pre-hospital buprenorphine program, which has been my baby here at the city of Pittsburgh, and something I wanted to do from day one as an AmeriCorps Vista. And we're finally, by the end of this month, hopefully expanding to all of Pittsburgh EMS. It's a program that allows paramedics to actually give something to people experiencing an overdose after they've been revived in real time. So about 30% of patients that Pittsburgh EMS comes into contact with decline transport to the hospital after they have an overdose. So in practice, this means hundreds of patients every single year having an overdose, and they don't go to the hospital, which at its best can be a hub for resources and connections to all sorts of things that patients can use to hopefully enter recovery. But when 30% of patients are decline transport to the hospital, EMS really doesn't have the ability to connect these patients to any sort of resources. There's no referral power in EMS. So what we've done is equipped paramedics with a very effective recovery medication called Suboxone or buprenorphine. People in my office call it the Boopadoop program because buprenorphine is a very difficult word to pronounce, which gives paramedics the ability, after someone has been revived from an overdose, to reverse somebody's withdrawal symptoms. So instead of having to go out and use again to reduce their withdrawal symptoms, they can give them buprenorphine or Suboxone, same drug, and they can make them feel better in real time and then refer them to a telemedicine line where they can get more of the medication prescribed to them within 24 hours. This is a medication that is very difficult to get in a very short amount of time. This is a low threshold program that's helping more and more people every single month. And so that's one of the things I'm most proud of. So that's a few things that we've been working on that I'm proud of.
On a much smaller level, I think what's most, you were talking about the having Narcan and how to administer it, and when your boss Laura was still fairly new to the city, mm-hmm. she came to this room, and she gave a Narcan training to me and my staff, and gave us stickers. We have stickers all over the place here.
Yep.
I still have Narcan on my desk. Does Narcan have an expiration date?
Narcan does have an expiration date, but it's important to note that if all you have with you is expired Narcan when you're looking at someone who's having an overdose, you should still use it. Narcan, when it expires, does not become harmful. If anything, it'll just become less effective, but it probably will still work. But if you can get your hands on new Narcan that's not expired, then you should do that.
So I should call your boss after you leave? And
you don't have to call my boss. You can call me. I'll bring it back up here as soon as I leave. But yeah, Narcan training you were talking about, yeah.
I think those are the types of things, those types of trainings can only be beneficial to city employees. I can't imagine one of my staff or a colleague is going to have some sort of substance overdose during work hours, but it's still good to have it.
Well, I wouldn't say that's necessarily given, and I'm not trying to say anything against anybody's staff or any staff at the city of Pittsburgh, but it is possible, right? Substance use it can affect anyone, right? And so we want to make sure it's widely available. But also you can think about it in terms of walking to work every day. The Central Business District downtown has the most number of overdoses of any neighborhood in the city each month, based on our overdose dashboard, which is another project I forgot to mention before.
But it's real-time information that you have.
It's real-time information. And you can see that just by walking to work, there's a chance that you can come into contact with someone having an overdose. But also, if we get it to people, they're not just using it in the course of their job, they can also take it home with them, right? And then use it if they come across someone in their community, wherever they live in the city of Pittsburgh. So it's just good to get out there and that everyone can have access to it.
That's fantastic. I think that's great. Just another, I don't want to simplify it by saying it's simple, but it's another simple way to help people who are in need with tools we may not have had 5 years ago.
It is simple. It's a really easy way to save a life. And that's really like the bread and butter of harm reduction. But obviously some of the things we're getting into are like more advanced forms of harm reduction, like syringe service programs. So there's the further up the chain you go of harm reduction, the more involved you get with it, the more you realize it is really not the only, but it is the chief solution to making substance use safer and saving lives.
That's great. That's all great. You, in the short time you've been with the city, you've made a major impact. You should be proud of all of that.
just because of the people that I work with and Laura creating the office and empowering me and the people we work with to do so much of this amazing work. And also a lot of it wouldn't be possible without the people in public safety who are helping me implement it. So I know can be cliche to say maybe, but it truly is a team effort. Really, really is.
So why would you leave this?
So I
guess this is a natural progression. What is it that you're doing next that is having you leave us?
So I ask myself the same question. Why would I leave a job where I'm able to do all this great work and really make an impact, which is what I've wanted my whole life? So at the end of July, I'll be leaving the city of Pittsburgh, very sadly. I'll be going to law school at the University of Connecticut in Hartford, Connecticut, starting in the end of August. So my hope is that I'll be able to continue this type of work. I'm not sure exactly what area of law I want to go into. I think I'm leaning towards something more along the lines of influencing policy rather than being a practicing attorney, but I am keeping an open mind. Certainly it will be in the area of public service. I would love to work for government in the future. I've learned in this job that I love working for government. Government is where it's at. If you want to make change, government is where you can really make it happen. So I don't really foresee myself going into like corporate law or anything like that. Nothing against people who are in corporate law, but
so you're saying I will not see your face on a billboard on the side of a highway?
Yeah, I'll go, yeah.
Sorry, Heather.
Probably not. I really want to go into the area of public policy, but we'll see. But certainly in the area of public service.
So you and I have spoken a couple of times. I have a history with the city of Hartford. I went to school in Hartford. You said your mother went to school in Hartford,
mm-hmm.
and you're going to the UConn campus in Hartford?
Yeah, so the law school for UConn is in Hartford, yeah.
That's amazing. So you have this, you're almost a legacy there.
In the city, sure. And it'll be, I love Pittsburgh and I've grown to love it so much over the past 6 years. It will be nice to be closer to my family again, but it will be really hard leaving the city of Pittsburgh. I'm trying to do all of the fun Pittsburgh things I've always wanted to do in the last couple of weeks here. So I'll be sad to leave.
I've only been to Hartford once in the last maybe 25 years. Mm-hmm. So don't ask me for suggestions or.
Okay.
I worked. The Whalers left, and I stopped paying attention to the city. I went about 4 years ago for a college reunion. I went down roads that weren't there. There were one-way streets that were facing the other way now. It was very strange.
I know you're a big Red Sox fan. Even though I'm moving to an area where there are probably a lot of Red Sox fans, I won't be becoming one. I just want to make that very clear.
Well,
even though you didn't ask.
That's your problem.
Make that really
so
clear.
Hartford is split down the middle by the Connecticut River, which is New England's barrier.
Oh, I didn't know that.
To the right of it is the Red Sox fans, and to the left of it is the Yankee fans.
So UConn Law's campus is like less than a half mile west of the river.
That's your problem.
So I'll continue to be a Yankees fan. That's okay. I've definitely adopted the Steelers in my time in the city of Pittsburgh.
Also your problem.
But while I love going to Pirates games and love PNC Park, I think I retained my Yankees fandom.
So Hartford has a brand new. Well, it's not brand. It's a couple of years old. They have a minor league team there. It's the Yard Goats. It's right in downtown. Beautiful stadium right downtown. It's since the Whalers left and they only have minor league hockey there now. It was nice. It was a nice addition to the downtown area. I drove by the stadium when it was first built. I think that's when I was there.
Stadiums are on my mind today because of the change of the name of Heinz Field. I saw something funny on Twitter this morning that said it's the worst thing to happen to Heinz Field since Bane.
That's fair. I thought it would have been perfect for a toilet manufacturer, hear me out, a toilet manufacturer to take the name of the stadium as a nod to the Pittsburgh Party. And no one followed me with that.
For the longest time, so I go into a lot of people's basements as a paramedic, right?
Okay.
People fall and they're in their basements or they have medical emergencies. And especially when I was precepting in paramedic school with the city of Pittsburgh, like I went to a lot of basements and we're like, what are these random toilets just sitting in the middle of, like, they're just out in the open? And so I asked and I learned what the Pittsburgh Party is. So that would actually be a great name for the like the Alcosan Field, Alcosan Stadium. I don't know. I don't know if an authority can buy has the money to buy a stadium.
I Googled toilet manufacturers because I didn't know, and and the name Kohler came up, and I thought Kohler Complex.
Kohler Complex, that'd be good. I mean, you can't change Heinz Field though. They're going to remove the ketchup bottles? You're telling me they're going to take away those ketchup bottles?
Yeah, they're taking them down right as we're recording this. They're taking them down.
It's a sad day.
Yeah. My Pittsburgh Party story is the first. My wife's from Pittsburgh, but when we moved here together, we were renting an apartment in Squirrel Hill, and the movers were bringing things into the apartment, and my wife says, "You need to go down to the basement and find the thing, whatever." And I go down to the basement. And I'm opening cabinet doors, and I don't know what I'm doing. I've never been in this basement. And I open what I think is a closet door, and I'm staring at a man sitting on a toilet. And I close the door, and I go back upstairs, and my wife says, "Do you have it?" I go, "No, but why is a man on a toilet in our basement?"
Oh, my goodness.
And that's when I learned Pittsburgh Party. But the owner of the house had made what essentially was an outhouse in the house. By putting small walls around it.
Yeah, I mean, it's because people would come home from the mills, right? Yeah. And they would need to clean up.
So they would go into the basement first, clean off. If I remember what I've read correctly, there was also normally a shower nearby. Mm-hmm. So they would shower, sit on the toilet, and then go upstairs.
Right.
So
innovative.
I had no idea that this conversation was going to become about toilets, but.
I mean, I'm not mad.
I bet you didn't either.
No, certainly didn't.
All right, Josh, this is the weird part of the show where I'm going to ask you a bunch of questions that have nothing to do with anything we've been talking about.
Let's do it.
Okay. You should remember this because I forgot to mention you've been on this show before.
Yeah, we did it collectively as an office a few months ago, or several months ago.
I think it was actually last year.
Wow. Okay. Yeah, it was last year.
So, but instead of just giving you one question across 10 people, I'm going to give you 4 questions just for yourself.
All right, let's do it.
Okay, you ready?
Yes.
What's your go-to karaoke song?
Vienna by Billy Joel.
Ooh, interesting.
Love Billy Joel. It's kind of sad though.
We're going to see him in August.
Really?
He's coming to PNC Park.
Oh, I'll miss it. But he plays at Madison Square Garden a lot. So.
Yeah, and that's 45 minutes from where you grew up.
Yes, it is.
Yeah, okay. What was your favorite childhood cartoon?
Probably SpongeBob. Classic.
Oh boy. Okay. That ages you right away.
Well, it's been on TV since like 1999, I think, something like that.
I was 24 in 1999, Josh. So.
What was your favorite cartoon?
He-Man and G.I. Joe.
Those are good ones.
He-Man, because of course you would want to follow a man in his underwear as he runs around with a sword.
Right.
Who wouldn't? And G.I. Joe because the bad guys were like stormtroopers. They couldn't hit the broadside of a barn. Yeah, and all the lasers. Instead of guns, it was all lasers, and I just found that funny.
Those are good ones.
All right, here's your big Pittsburgh question.
Okay.
You love Pittsburgh, right?
Yes. Yeah, of course. Yeah.
Do your sandwiches have fries or do they have no fries?
No fries.
What?
I don't know. Maybe that's just one tradition I never really adopted. I'll say the same for salads. I love fries. I just, it never grew on me.
You know, they all go to the same place, right?
They do all go to the same place, down the same pipe.
So you like fries, you like salads or sandwiches, but you don't like them together.
I think when I finish my sandwich, I want to have something to kind of snack on as I'm still talking. And so the fries is like a good way to do that.
You know, everybody in Pittsburgh who's watching this right now was nodding their head. They were excited about you. They're happy for you to go to law school, and now they're already throwing stuff at their television sets.
I can never return, I guess. I'll be run out of the city.
Okay, so as a paramedic, you probably a lot quicker than the rest of us understood the importance of masks once the pandemic hit.
Yeah.
So what is your favorite COVID mask that you have seen on people over the last 2+ years?
Like a ridiculous type of COVID mask?
Sure.
I mean, I really love my P100 respirator, which I used
Like
a
I
lot
said.
during like the height of the pandemic. So that was really good, although it was very hot. I most often go to my trusty N95, but I definitely saw a lot of funny ones online, like milk jugs or something like that. But I don't think I saw any ones that were too ridiculous.
So when your boss was on this show just by herself, she and I had a long discussion about my Silence of the Lambs mask, my Hannibal Lecter muzzle mask. I don't wear that anymore. My wife said I'm not allowed.
Just go crawl around the depths of Soldiers and Sailors with your
Pretty
Hannibal
much.
Lecter's mask. Yeah.
But I like the masks that look like somebody's face, like a totally unshaven
Yeah,
face.
that's a good one.
So they put them on, walk into public, and somebody says, "Sir, you have to have your mask on." And I go, "It is my mask."
Yeah, I guess maybe my favorite one, it's that same concept, but it has a mask around like the person's chin, like
Yes.
they pulled it down.
Yeah.
So it's almost like they're clearly they're trying to flout the rules, but
Right.
then they're like, oh no, that's my mask. That's a good one.
All right. So those are the 4 weird questions. You don't have to. I'm not going to.
I like weird questions.
I know you're leaving, and I know that it's not like people are going to pick up the phone and call you. But if people want information about the Office of Community Health and Safety or any of the programs that it's providing or any of the work that it's doing, and somebody's watching the show and wants that, how do they get information?
Well, any general questions, you can email ochspgh@pittsburghpa.gov. There also is the opportunity on our website, OCHS website, to schedule office hours with anyone in our office. If you have specific questions about a specific area of work, you can schedule office hours and you'll see our live calendar and you can just schedule time with us to talk about it. A couple people have done that with me. But yeah, any general questions, just reach out to that email or schedule some office hours.
Into the office hours, can those office hours be in person and virtual?
I think it's set up to be virtual right now, because it was created during the time when we were all virtual all the time. But I'll have to get back to you on that about in person in the future.
You don't have to because you're leaving.
Well, sure. Yeah, I guess that's right.
All right. Well, Josh, thank you for the time you've been with the city, for all the work that you've done, for the way you've brought these issues to the forefront. We want to thank you for everything you've done with the city of Pittsburgh while you've been here. We wish you continued success in law school. And that's the other thing. You're going from pre-med to law.
I was that annoying pre-med kid. I was like so sure he was going to be a doctor. And then it was a combination of what I described, like I wanted to do more public policy focused things, but also organic chemistry was miserable.
It sounds miserable.
And so it definitely helped push me a little bit in the other direction. But yeah.
Well, anyway, congratulations. Good luck.
Thank you.
You always have friends here in Pittsburgh. That's what I'm told.
Of course.
Come back and see us sometime.
I will.
And when Laura still hasn't filled the position in 3 or 4 years, make sure to give her a call and say you want the job back. And of course, she'll be in the corner talking to herself and pulling hair out of her head. But yeah.
I will do that. And the work will carry on, I promise you. But thank you very much. It really has been the honor of a lifetime. And I want to keep doing this in some capacity, but this has been the best job I've ever had.
All right. And to those of you watching, I say thank you for watching. And we'll see you next time right here on Meet the People.